So the question comes to Caroline now on adjuvant treatment modalities. There was an update on COMBI-AD at this year's ESMO conference. The data have been published on the same day. So can you summarize the findings of this clinical trial and also remind us on the design of the clinical trial?
Yeah, it was a randomized phase 3 trial with 2 arms, placebo versus dabrafenib. So we already have seen the results. It has been published in the New England Journal of Medicine. We know that we have a very significant benefit in terms of relapse-free survival with a hazard ratio of 0.47. And then we also have the 3-year overall survival data that is also, I mean, statistically did not really exactly reach the pre-specified, but it's quite, I mean, we all know it's very good results. Now we have an update of this trial with a 4-year follow-up, and we still have a very good relapse-free survival benefit, a very good distant metastasis-free survival benefit. The hazard ratio has changed a little bit, it's 0.49. But we also have something quite original in our field. It's not something that is new in the oncology field. There was a calculation done by the statistician of the cure rate model. So if you look into all these papers, it's really mathematics, it's really difficult to understand, it's full of equations, but there are several models that have been developed to try to predict the rate of cure. So it's based, of course, of the follow-up. You cannot do that in a very young curve. If you have a lot of censored events very early, you cannot. But if you have quite mature trial, so you incorporate also some data on the biology of the disease. It's different from one cancer to the other. But then, at the end, it's quite strong mathematical model to predict that these patients, the event, which is death, is not going to occur. So patients are so-called immune or cured. And based on this model, it seems that the survival curves is totally superimposed with the cure rate model curves. So when you see that, it's very impressive. And at first sight, you might think, well, it's strange, it's exactly on the same. But in fact, it's from calculation. So at the end, it seems that in the dabrafenib arm, we will have 54% of patients cured, and in the placebo arm, only 37%.
So I wanted to follow up on that and note why I think it's particularly important for clinical practice, which was when we initially saw the curve for relapse, there's quite a dramatic benefit in the first year, but we start to see that curve fall precipitously when patients are initially taken off drug. And there was clear delta there at a benefit at 3 years. And then the big question in the field was, what's that going to look like over time? Because if it continued to drop, maybe this is you're pushing it back, but you're not curing the patients. Many had already believed that there truly would be a delta there, but this kind of data is very reassuring to know that truly you are giving the patient the potential for cure by giving them this adjuvant therapy.
Yeah, I forgot to say very importantly that the treatment is given for 1 year. Yeah. And the fear, because of what we know about targeted therapy, is that after 1 year it was going to drop. Very important. Yes.
Yeah, I think it's very important that you maintain the benefit between the difference between the 2 curves over time. And this has been shown, and it's nice data. And you know, there was also a risk in the very beginning. If the curves collapse over time, you know that after 4 or 5 years, there's no difference. But now there's a big delta, and it's very promising data. And I need to say the quality of life of the patients, which has been evaluated, is extremely good. Also, 25% of the patients stepped off due to some toxicities during the 1 year of treatment. But there is exciting data.